Hello, my name is Jo Finningham. I'm Clinical Director of Allied Health Professions at NHS Improvement. Thank you for all coming. It's really great to have you all here. Before I start, I must just say, you've all seen our technical abilities here at the front. That we are sellotaping an iPhone to a broken stand. We are recording each of the sessions, one so that we can share them with yourselves, because what we realised was that some of our slides might not make sense without the narrative, and of course you will have all heard it today, but you might want to listen back. Some of the themes and messages are kind of quite difficult to get your head around. We find it quite difficult at a national level, so sometimes I think it's useful to be able to listen back. But also as well, some of you will know, I think, that I went to Singapore recently, and they're really fascinated in some of this work that we're doing. So we want to be able to send them the videos as well and the slides, and we may possibly be going back to Singapore to do some more of this work with them. So that's really great. So the video will only be filming anybody who's up here, so please don't worry. But if you want to be at any point, I'm sure that our Singapore colleagues would appreciate that. So today is all about it's all about how do we evidence AHP resource and the impact that it makes. So some of you might have been to the regional events this time last year, where again we were talking about operational productivity and workforce optimisation. And what we've done since then is been on a very big journey in terms of really thinking about lots of head scratching around what is it that we need to do nationally as a team to support that work, and what is it that we would like you to do as AHP leaders so that you've got the tools in your toolkit to be able to evidence the impact of AHP resource. Now there are lots of different terminology that's bandied about in this arena, and again we struggle with that nationally in terms of, are we talking about safe staffing, safe effective staffing, are we talking about operational productivity, are we talking about workforce optimisation? We're talking about them all really. It's all about how do we evidence the value of the care that we deliver in the greater scheme of things across the system. What are the elements of a toolkit that we would need to be able to demonstrate that, both within organisations, at a regional STP level and at a national level? As I said, we've been doing some work on that, and mainly over the last 12 months a lot of work has been done by Roz and her team, which has been a small team and then a one team and then a team again, around the operational productivity agenda, but it all interlinks in terms of workforce planning, and that's for the work that Helen's doing, and overarching that around leadership. So I think that's enough to set the scene here for this first slide. So housekeeping. There's going to be no fire alarms today, so if the alarm sounds, then we need to move out of this room. The exit is out of this door and to the right, the fire exit. And I think, Steph, do we just congregate on the car park? Yes, there we go. Toilets, hopefully people have found them, they're just outside the doors here. The refreshments, hopefully everybody's found them out just where you came in, behind reception, so you can help yourself at any time to refreshments. We will be having a break this morning, a break this afternoon, and lunch at 12:30, Steph? Lunch? 12:15. 12:15. Yeah. And lunch will be served in the restaurant, again, behind reception. Please tell us about room temperature. As you know, in these events, there's always somebody who's too warm, there's always somebody who's too cold, so we'll just keep adjusting as much as we can. And please, if you want to figure about yourself, please do. We're all in this together. You know, talk to your colleagues. Are you hot? Are you cold? You always get it on a feedback form somewhere, don't you? So, please, let's just all take responsibility for our own temperature. And anything else, please just ask any one of us. So, I mean, it might be useful for us to introduce ourselves now at this point. Do you want to?
Yeah. So, hi everyone, my name is Roz Campbell. I'm the Allied Health Professional Productivity Lead for NHS Improvement. I know a lot of you here today, so fantastic.
Hi everyone, my name is Stuart Palmer, so I'm Professional Head of AHPs and I'm mainly looking after the leadership portfolio. Jo.
Hi everybody, Helen Conway, keep forgetting my name.
Just married.
Sorry. So AHP Workforce Improvement Lead, so anything workforce planning, all of that nature of improvement, that's my bag.
Steph? emails from Steph. Steph keeps the cogs turning, as you probably know. Admin and business support is so crucial to the team. Met some of these people already, but this is kind of team AHPs at NHSI, so just wanted to show you everybody. So who isn't in the room? Caroline Poole, who was formerly clinical fellow, leading on some of the leadership work initially, and then handed that over to Stuart, and now Caroline's working on Flow, which I'll mention briefly. And Glenn is just coming to the end of his clinical fellowship, was focusing on mental health, and also did a national collaborative around closing the gap, which I think some of you in the room were involved in. So that's great. And just to say as well, my intention is to have another clinical fellow role rolling into next year. So again, if anybody is interested in doing a fellowship, then please do look out for that when it comes to advert, probably in the new year. What else have we got on there? Oh, Claire's on maternity leave at the moment.
We've appointed a replacement, so
yeah,
we're starting soon.
Okay. So that's all of us. So I'm going to do a couple of slides now, just letting you know about some of the things that we've done since the last time we met that aren't specific to workforce optimisation, operational productivity, but are very much linked, and also just an opportunity to share some of the other work that we've done. So you've heard leadership mentioned lots and lots, and we've been on a real journey in terms of leadership, and some of you will have heard some of my narrative, so forgive me. So when I first started in HSI, probably I'm coming up to 2 years now, although I still feel quite new, I was given the challenge by Ruth Mays: what are we doing for AHPs and leadership? Do we need to commission a course for leadership? It's off the back of Developing People Improving Care, which is the national framework for action on leadership and improvement capability. So that's kind of our national driver. Again, in NHSI and across our arms length bodies, we see leadership as absolutely crucial and critical to driving any piece of work. And again, workforce optimisation, operational productivity is one piece of work that we need leaders out there in the system to be able to drive some of this. So since when Ruth questioned me about that, I had lots of questions. I came out visiting services. And what I had more questions than I did answers back to Ruth, which was, I think we really need to get a grip on, or understand better, what does AHP leadership look like across NHS provider organisations in England? What does it look like now, and what do we need leadership to look like for the future? So those were the questions that I had in my mind. Kingston and St George's University answered those questions for us in a very quick turnaround piece of work. We asked them to do quite a lot of work, didn't we, Liz? And in quite a short space of time. And they produced a fabulous academic evaluation, which you can find on our website. And again, if you want to talk to Liz about it, I'm sure she'll be more than happy. But from that academic evaluation, we produced this publication, in which it's a publication that is a self-assessment for boards to look at and to evaluate their leadership in organisations. But off the back of it, what we're recommending is that trusts appoint a strategic AHP lead. And the reason we're doing that is, off the academic evaluation, we now have evidence that it matters. The two kind of sparkly diamond pieces of information we've got from it is, have we got a slide on this, Stuart? Probably not, no. Is that we know that there are two things if you've got strategic leadership in place. One is that staff, AHPs, feel much more connected to the board and the organisational objectives, and they're more likely to be involved in quality improvement. That's one little diamond. And the other little diamond is, where there's strategic leadership in place, there are more published exemplar case studies. So like in the nice shared learning examples, AHPs into action, CAPO awards, for example. So we know it makes a difference, and that's why we're asking trusts to appoint. Since we published this document, it's more than 5,000 now.
Yeah, it's just tipped over 5,000. Yeah.
The document's been downloaded over 5,000 times, so we know there's interest in this, and we know it because we've been massively inundated by trusts asking us, how do we consider this in our organisation? What does it mean for our organisation? We've done a number of workshops in trusts where we've gone in and we've used this document as our guiding principles to have a healthy discussion and a healthy debate in organisations about what does your leadership look like and what does it need to look like for the future. And we know that's crucial because, kind of backtracking now, is one of the outcomes of the evaluation was that what exists, or what does AHP leadership look like, is we know there's just huge variation, and that cannot be right across organisations. You know, we know who the go-to person is who's responsible for nurses in an organisation. That's the director of nursing. We know who the go-to person is for doctors, for medics. That's the medical director. But often in organisations, we don't know who the go-to person is who's responsible for AHPs. There was mass variation, and it was just interesting us going round here today about the different everybody's different job titles. You know, and that's a very clear and challenging question back to organisations: is who is your go-to person who holds the responsibility for AHPs in your organisation? So that's what we've been doing, and we've been continuing to do that, and we're continuing to have people ask us to support that. So please do, if you haven't seen that document or you haven't had those discussions in your organisation, please go and do that. And we'll talk about that a little bit later, won't we, Ros, in terms of the work, the toolkit that we're talking about to you today is, have you got the accountability and responsibility to be able to roll out some of this in your trust? And if the answer's no, then it might be that you need to question about where does that leadership sit and where does that accountability sit. So these are just some other things we've been up to as well over the last 12 months. So we've been running 4 collaboratives. So this is a methodology that we're using as part of our improvement bit, so improving care. So the methodology we're using is the model for improvement, and we use a 30, 60, 90-day model. So we invite trust to come with an improvement idea, a change idea, and we step them. We talk about putting a metaphorical arm around trust to step them through an improvement journey over 30, 60, 90 days. So that's the methodology that we use, and these are the different collaboratives that we've been running. So the Public Health and Prevention Collaborative, we've done one cohort. We've been working with AHPs for Public Health, so the virtual network. On that, we invited AHPs who had change ideas around implementing public health and prevention into everyday practice, and we've had 18 projects go through that for public health and prevention. Things like one of the projects was increasing smoking cessation on a vascular ward, for example. The Flow Collaborative is off the back of, I don't know whether people saw the quick guide AHP supporting patient flow that was published in April by our team. So the publication came out, and then the collaborative was about, well, how do we get more of this into practice? When we asked trusts if you want to be involved in this collaborative, we had an overwhelming response to it. So we had over 50 trusts asked to be part of that collaborative. And I guess one of the reasons for that is it coincided with Pauline Phillips, the National Clinical Director for Urgent Emergency Care, announcing this national ambition to reduce longer lengths of stay by 25%. So trusts were looking at how do we do this? So we had over 50 trusts. We only had space for 25 trusts in the first cohort. So again, it was like the hottest ticket in town. I don't know whether anybody came to the director of AHP's event that we did. That was also a hottest ticket in town. But I think it just shows as well that if you throw an olive branch out to AHPs, they'll grab it. And we had lots of people saying to us when they submitted their applications to Flow is, I've wanted to do this change idea for so long, like I've not been listened to in the trust. So this is all about front door stuff, back door stuff, home first, all those types of projects are in this. So we ran cohort 1, we've been able to secure monies for cohort 2, which is just running at the moment. And we've got loads of eyes on us with this nationally because it's reporting into the National Urgent Emergency Care Programme Board. And we've already written a business paper to see, we're waiting to hear if they want us to roll that out next year across the 7 regions. So this could massively scale up.
Sorry, Jo, can I just ask, is it only acute trust involved?
No.
Right.
So this, how we went out was we wanted again to offer out the fact that AHP should lead in this arena. So the project teams that are coming to the collaborative are normally led by an AHP lead, but they're multidisciplinary projects. So for example, there isn't somebody in the room.
Locally with us in Shropshire. Yep, so we've got our AHP lead in our community trust.
There you go.
And our inpatient therapy manager working together to develop some pathways. So we're involved in that.
So the team, we weren't prescriptive of what the team should look like, but we were just amazed that people were coming with representation from different organisations, because that's what Flow's about. So there was another, I think that there's one team that's got a representative from the CCG, a representative from the Community Trust, a representative from the Acute Trust, and a representative from the local authority. And they're doing a piece of work around Home First. So yeah, so some really, really great stuff happening with that. And the other collaborative that's just finished, again, some of you will have been involved in this, I know Sally, you have as well, is Glenn's Closing the Gap collaborative, linked to the national secret. So this is about closing the gap between, it's about parity between physical health and mental health. So that's had some good traction as well. So all the ones that have finished, we're writing them up and producing impact reports, and we're really hoping that we can share some of that good stuff back out with you. So all this I think is the really exciting stuff about how do we actually make this happen in trust. So that's all. So what we wanted to ask of you today is, these are the areas that we've been focusing on. So leadership, flow, workforce planning, optimisation, operational productivity, closing the gap. These are all that have been our focus for this year. We're just going into the planning round for next year, and what we'd like to know from you is, are these the things that we should be focusing on nationally, or are there some other things that you think are really big hitters, that if we had a focus on them nationally, that would help you locally? Are there some things that you think we should be doing that we're not doing now? Are there things that we're doing now that you actually think of, or that it's run its course, that we don't need to do anymore? So we'd really love your ideas, and if you want to write them on post-it notes and stick them on the flip chart, that would be really, I'd be really grateful. Or come and chat to any of us about what you think and what your ideas are. So there we go. I think it might be useful to say at this point as well is, off the back of that is, some of you will have heard two big announcements, is that I&E, NHS England and NHSI are aligning. And then the very recent announcement this week that HEE will also report and be accountable to NHSI. Again, some of you will know of our national team, so Suzanne Rastrick, Bev Harden, Linda Hindle, that we've always worked very well together in a matrix fashion anyway, but these announcements, I guess, will just help and be a greater opportunity for us all to work much more in alignment, rather than in a matrix way. And that, I guess, telling you that in terms of we're much more thinking about being aligned in terms of our business planning. I need to motor on now, don't I? So today, why are we focusing on workforce? Why are we focusing on operational productivity? Well, you can't go a week without seeing some sort of headline around workforce, around staffing, around retention, around money, around how do we evidence the quality of care that we deliver, and this is just a selection of those. Everything that we do, as you probably know, is driven by our national strategy, AHP's Into Action, of which in it, again today, across the strategy, what we're doing today aligns with them, so delivering evidence-based informed practice, further developing AHP skills in terms of the workforce, very much evaluating, improving and evidence the impact of their contribution, that's the big one. But across all of this, staffing is our biggest resource. So how do we get the most value out of that resource for the money and to deliver really great quality care? How do we get the most value? That's really what we're talking about today. I just skipped over this. Maybe I should talk about it. So I guess the reason we put this in is because we were really proud, I don't know whether anybody's seen this video, that AHPs are being seen as the next secret weapon, I guess, and it's really great. We've already always known that, haven't we, that we're crucial and critical in the system. But Simon Stevens, the CEO of NHS England, in this video talked about we need to unleash the energy, insight and brilliance of AHPs if we're to be able to deliver integrated care. I won't show the video in interest of time, but we can probably post it on Twitter for anybody to look at, or you can Google it. We can play it during the break.
Yeah.
But it kind of feels like our time. But equally in our time, and that we're bubbling up in terms of interest in the services and what we do, is we equally have to be able to evidence that impact, don't we? And we all know that. Oh, I'm going the wrong way. Yeah. So, this is a very busy slide, but you'll become very familiar with it by the end of the day, and I'm sure you'll all want to take home a copy. So this is Roz's plan on a page that has been produced after, I guess, 2 years more of head scratching around how do we put, what are the pieces of the puzzle that we need to be able to evidence what we do. So for those of you at the workshops last year, we were talking about inputs, outputs and outcomes. Those were kind of the 3 buckets we were thinking about. And of that, we think that there are several elements that we need to be able to evidence, and we need some tools to help us to be able to evidence those different elements. So we need trust to be able to measure and benchmark productivity. We need trust to be able to optimise their workforce. And then of that data, we want them to be able to have an opportunity to look at where there is a warranted variation, so that we can start to utilise the resource to best effect. We can look for those productivity opportunities. So this really is a plan on a page, and when Roz first emailed this to me, I was like, yes, Roz, yes, this is all the elements that we need. Now today what you'll see is that we don't have all the answers to this page at this moment in time, but we've got some answers to it. And what we want to share with you is the answers that we think we've got and the tools that we've got nationally to help you to go away and start to implement some of this. And then also we want to talk about some of the elements that we're going to be working on over the next 12, 18 months. So, we think it's time to think differently, but we know that this topic is really, really difficult, because it's really head-scratch stuff, isn't it, Roz, about what are the pieces of the toolkit that you need, and I'm sure we'll have some healthy discussion around how do we evidence input, output and outcomes. How do we start to show the impact of our resource? And we've got some tools to share with you today. We haven't got the whole picture, but we're on a journey, and we're all on a journey together. So the purpose of today is to provide an overview of the national priorities and products that we're developing, and also to share with you the bits that we are planning to develop. We want, hopefully by the end of the day, you will have got your head around that interface between workforce planning, optimisation and productivity, and what all those elements are and how they, the interface between them. As I said, we want to look at, we'll be really open about what are the bits that are missing and what are the bits that we still need to work on. We're going to give some practical examples that will hopefully be of benefit to you back in the workplace, and tools and top tips. And again, we're using different language here, isn't it? But it's all part of the same picture: safe, effective, sustainable services, workforce optimisation, workforce planning, operational productivity. It's all part of that package, and hopefully that 3x3 vision will help to get your head around those different elements. So I think I've probably said some of this already. You know, we're all autonomous in terms of our role. We see ourselves as a national team as, you know, my priority since I've been in post is how do I help AHP leads in their organisation so that they can help their workforce so that we can deliver really great quality care. So we're all responsible for our own roles and our own behaviour. So again, I hope today you take it as an opportunity to share, but so that there's a two-way process. We can learn from you, you can hopefully learn from us, and together we can go on that bigger journey.